Hi and welcome to my channel. So in today's video, I'm going to be talking about a very sensitive topic because a 27-year-old nurse has been given a life prison sentence for something that is a taboo, let me put it that way, in healthcare, something that as a healthcare professional, none of us should ever consider, or it should never even cross your mind if you're in healthcare. And so the purpose of this video is more about a learning experience, is more about reflection for the rest of us, and to say that look, healthcare is a delicate career, it's a delicate profession, and it's not for everybody. When I say healthcare, it doesn't matter what it is. It does not matter whether you're a clinical staff or you are a non-clinical staff, whether you're a nurse, you're a carer, you're a doctor, you're a midwife, you're a housekeeper in healthcare, you're a cleaner. It does not matter what you do, but if you don't have that call, that compassion, that empathy, and that drive, and the patience, importantly, you should please don't consider coming to healthcare. There are loads of other professions that you can do, you know what I mean, that will probably work best for you than coming to healthcare. So if you're new to my channel, you're welcome. If you're a returning subscriber, I appreciate your time. And look, I provide information on this channel about different ways to move to the UK or get free visa sponsorship opportunities to remain in the UK if you're already in this beautiful country. Work from home jobs that you can do from the comfort of your home without those geographical boundaries and limitations of traveling to work and all of that, as well as career progression in the UK. I'm, an advanced nurse practitioner myself. I'm very keen on career progression. So I have a free newsletter where I send that information directly to your inbox so you're not reliant on the YouTube algorithm. If you check the comment section below, I've dropped a link to my newsletter. Once you join, then I send that info directly to your inbox. So what is it that we're talking about today? What happened to this nurse? So this nurse, basically 27 years old, he went out, for a night out or whatever it is that he did, and then went to work the next day. So when he went to work, because as you know, nursing and healthcare is something that you're dealing with human beings. Your patients are going to have needs, they're going to be buzzing, for example. You need to go and attend to those patients. So this nurse basically heard those patients. I don't want to use the right word, but you can imagine what he did. Because those patients sadly passed away as a result of his actions, heard those patients, and the reason he gave was that he wanted to be left alone. Like they were disturbing him and he wanted to be left alone. Please, I want you to leave a comment in the comment section. Are you in healthcare? What do you think about this situation? What advice would you give to somebody that is planning to get into healthcare or that is currently in healthcare and finding having some stress, some nuances, because we know that no job is perfect. Healthcare can be a very high pressure and high stress situation and environment. So there is a lot of support that is needed. Unfortunately, sometimes we don't get that support that we need as healthcare professionals, but that's why we've got our colleagues there to support us. So if you've got any words of encouragement, any ideas, anything that helps you to relieve your own stress as a healthcare professional, or anything that you would recommend to healthcare professionals, you don't even need to be in healthcare, so that it helps with that mental health and that well-being, so that we can better care for the patients that we should rightfully so be caring for. Please drop that in the comment section below, and I'm sure that all of us will appreciate it, myself included, because like I say, we have those moments where it's very stressful. And talking about that, recently in the UK, in fact this week actually, a UK nurse was suspended for 12 months. 12 months suspended without pay, obviously, because she had a patient that had deteriorated, that needed CPR, so that's cardiopulmonary resuscitation. The patient needed to be resuscitated, and this UK nurse declines resuscitating the patient, saying that she is too old to perform CPR at the age of 62. So I then ask, if you are a nurse and you're still working at that age, should you be exempted from certain duties? Because was she the only nurse on duty? Were there other people that I could help? How could, was she sick? Was she unwell? Is she physically, I don't know, you know what I mean? There are so many ifs and buts, but the truth is that if you feel that you're very stressed, there are lots of support systems that they have. In the UK, they have what is called speaking up guardians. So if you have something that is really troubling you at work and you want a confidential, confidential conversation, you can contact those speaking up guardians, and every area has one. Even if you don't want to speak to somebody in your area, you can find another speaking up guardian from a different area and you can speak to them. There are also many charities in the UK that focus on helping and supporting with mental health, because the truth is that many of these things is stress, depression, anxiety, that causes all of this, because a normal human being wouldn't act in such a way. So one of the things I'm trying to highlight is the fact that there is a lot of support out there. And while it may seem that we can deal with everything, it is not always possible. There are those moments where you need to stand up, put your hands up and say, look, I'm Melvis, I'm struggling, I need support. Sometimes, as healthcare professionals, all we do is keep pouring to other people, caring for other people, and we barely have any time for ourselves. And I think that's when, again, you need to take a step back and reflect on what exactly it is that you want to do going forward. So obviously, this is something that is absolutely despicable. You cannot say that, or you don't want to be disturbed as a nurse or as a healthcare professional, because that's why those people are there. They are vulnerable at that stage. Or if you're not well yourself, just stay home. You don't need to go to work. Just ring your job and say, look, I'm sick, because if you're not well, it's but fair that you stay at home. And that's why there is sick leave. Again, if you're in the UK, for example, you get paid if you're off sick. So you don't need to get to these levels where you then deteriorate, and then it then has terrible consequences for everyone else around you, because you didn't take a day off work. It's okay to ring work and say, look, I'm not well, I feel really low. You go and see your doctor, make sure you've got a doctor registered, and just look after yourself as well and your well-being, because now this nurse is as young as 27, but he's going to spend the rest of his entire life in prison. You know what I mean? And not to talk of those poor patients that were involved in all of this. It is unfair for both parties, but I think it is about acknowledging the fact that we don't always have to give. Sometimes we need to take as well. Sometimes we need that TLC, that tender loving care. And it's okay to speak up. It's okay to say, look, I need help, I'm struggling. It's okay to put your hands up and say, help me. Because most of this is depression. It's work related stress, overload, staffing levels, pay. There's quite a lot involved in healthcare. But make use of the resources that are there. Speak to your colleagues, speak to your managers. Like I said, there are other confidential and independent bodies that also offer help. Again, if you want information about the things that I've mentioned and some of the things that I do, updates, then do join my newsletter and I'll send that to you. If you haven't subscribed to my channel, do subscribe, because it is well worth it. I'll see you in the next video. Bye for now.